gonna be a big lift. Ready? 1, 2, and 3. Today what we have is Reilly, who is our 20-year-old male lion that was brought in today because he had a fractured premolar. It's actually seen commonly in canids and felids all together. What do you think they do all day? They chew and they chew on bone. So again, they will occasionally get a fracture of that tooth.
He is one of the oldest lions in AZA institutions. He's been at the North Carolina Zoo for about 19 years. He's also sired multiple litters of cubs. All in all, he is a spectacular lion, and he's been a great father to all of his cubs. There's a lot of challenges taking care of geriatric animals. We do extensive training with him where the keepers are able to do voluntary blood draws. Of course, this is a deadly animal, so you can't share the same space, but he will present his tail for us, and we work closely with the vet team to do quarterly blood draws.
We've dedicated lots and lots of time to training this animal to allow us to pull his tail out of his enclosure and then get blood from him, and he gets meat ball treats for that entire procedure. We noticed on his last annual exam that he lost his body heat. Some of his body heat started to dissipate relatively quickly. He's covered with lots and lots of blankets. There's a heating pad underneath him. On top of him, he has what we call a bear hugger, which is an air circulated heating unit, circulating warm air throughout that. There's water bags around him. And the socks are another thing, because you lose a lot of body heat through your feet and your hands. Same thing happens with animals, so we put socks on their feet to prevent that body temperature loss. So some unique challenges of dental work on an animal of this size is, honestly, the first thing is the size, the level of dangerousness associated with doing an animal that, if it was to wake up, could eat you. That's always an added thrill. And then just because of the teeth are so big, they have really large roots. This is a 3-rooted tooth, so there's 3 roots associated with this molar, so getting that root out whole can become complicated and difficult. So we oftentimes will cut that tooth into multiple pieces and then extract it. We ended up bringing the dental team out from North Carolina State College of Veterinary Medicine. That team does dental procedures multiple times a day, where I may do 1 a month. So the speed at which he was able to extract that tooth is probably half of what it would have taken me.
I used to work in Brazil, in the University of São Paulo. So we also work with a lot of animals from the zoo there, like otters. We have jaguars and monkeys, so several animals. It's a big animal, so the tissues are harder. The instruments, there need to be enough for this kind of procedures. But I think that is exactly the same technique like in a cat. Just the only thing is the size changed a little bit. I was very happy with the procedure. He did a very nice anesthesia. It was completely stable during the procedure. That in these kind of animals is very important, because it's like you cannot spend too much time doing things. You need to go directly to the problem. In terms of the dentistry procedure, I was very happy. We were able to extract everything that we need to do.